Thank you, Scott. I just want to also, I may have mentioned this last week, the book is out in German. It was published by an academic publisher in September, so that's been pretty cool. So yeah, the topic, we've talked about this a while ago, but it's come up several times this week, and I thought it'd be a nice time to review it, and that's DBT, Dialectical Behavioral Therapy. It's come up in the course of our treatment at the unit in LA. It's come up in the chemsex group last night, and it comes up a lot. And it's, I think, going through a little bit of a discovery in terms of how applicable it is to addictions. And I would just want to kind of cover it because it sounds a little bit intimidating, but it really is a core set of skills that just kind of skills for living, honestly, but they're skills that are very practical for people in recovery and partners of addicts as well. So DBT stands for Dialectical Behavioral Therapy, which is a mouthful. Everybody's familiar with CBT, Cognitive Behavioral Therapy, but DBT is a slightly different angle on it. And it was discovered by a psychologist named Marsha Linehan. And she actually was working with borderline personalities, which can be a difficult population to work with. There's a lot of emotional lability or ups and downs and mood swings and interpersonal complications and things. And so she found these techniques work very well, these skill-based techniques. And then over the years, it's really been applied in other populations, from binge eating disorder to bipolar disorder to bulimia, anxiety, depression, PTSDs, and now finally addictions. And I want to mention it in terms of just the 4 categories of skills. Unlike CBT or other kinds of psychotherapy, especially psychodynamic therapy, DBT doesn't really delve into the history. It doesn't care about trauma so much. It doesn't care how the person got to the state they're in today. What it provides is skills to deal with it today. And so as an adjunct to other kinds of therapy, where you kind of digging a little bit into the past, it can be really, really useful. But for somebody in early recovery or even extended recovery, they're really very useful too. So I want to just cover briefly the 4 main categories of skill sets that we find in DBT. The first one being mindfulness. I think everybody is aware of mindfulness, but that is really the central feature of DBT as well. Mindfulness skills really just help us focus to live in the moment, right? It's all about noticing. It's noticing what's happening outside of us, using all our senses, vision, hearing, taste, and so on. And it's also noticing what's happening inside of us, and that the body sensations, the triggers, the cues, feeling relaxed, feeling on edge. And basically that developing that keen sense of awareness of outside, inside really starts to help people put together not only identifying triggers and cues before they can really gain power, but also to really help reduce mood swings, to head off, an angry response or outburst or something like that. So it's really very useful. The focus here with mindfulness in DBT and mindfulness in general is that we notice all those things inside, outside, without judging them. So we don't say, gee, I'm feeling this, that's stupid, or that kind of crazy negative self-talk we have. We just notice it and kind of make a note without saying that's good or bad. We don't place any kind of value judgments on it. But what that does, it helps us notice our thoughts, our feelings, our impulses, as I said, and it really just helps us slow down so we can focus on what's happening. Because what happens often with addicts and with life in general, I think we start to speed up, we react. And the core, I guess, goal of all the DBT therapies are allow us to respond as opposed to react, right? I think a lot of us react in automatic ways, and this allows us to really approach our response both behaviorally, or whether we're saying something or thinking something, in a more thoughtful way, in a way that avoids those automatic negative thoughts that can really trigger compulsive behavior. So it's a really nice way to just kind of notice things, build skills, and apply them. And that's really kind of probably the central feature of mindfulness. The second category is what they call distress tolerance. And the goal of distress tolerance, as it sounds, is to really learn how to accept the current situation that we find ourselves in, whatever that is, and ourselves. And it's all about really acceptance. And so to learn how to tolerate or survive a crisis, or even just a bad time, and there's 4 core skills within DBT. So you're starting to see there's the 4 core skills, then each of those has a subset of skills. And a lot of times these skills have acronyms, so you can kind of remember them. They spell out different words. I'll give you an example of that in a moment. So some of the things we use for distress tolerance, and it's the same things we tell addicts to talk about when they're feeling triggered, right? The first one is distraction. We distract ourselves. We learn how to self-soothe. As a second subset of distress tolerance. Self-soothing is something addicts and probably partners too don't do very well, right? I think as a recovering addict myself, I can say that my first go-to, if I was in need of soothing, was something outside of myself, right? Something to fix it. And this allows us to really transfer that back inside, where I can start to be empowered to know that I can provide a solution myself without needing to reach for a bottle or a drug or a behavior or whatever else that might be mood changing. Distress tolerance also helps us improve the moment. We, I think, often get in, especially sometimes in couples where there's recovery and there's a lot of feelings flying around. It helps us improve the moment in that moment. And then finally, if all that doesn't work, we can make a list. Let's see what are the pros and cons of my soothing myself and helping my control this distress or not. You know, what will happen if I don't do anything? What's happened in the past, or what would happen if I do, and how might I feel? So that's the second one. The third thing, and this is a really important one as well, it falls under the category of interpersonal effectiveness. So basically my people skills, my relationships with other people, how I do that. And again, where addiction is involved, those skills tend to get kind of rough or non-existent. We tend to react. We tend to react with an agenda of protecting our, speaking as an addict, protecting our addiction and our behaviors, and making excuses or blaming or doing all kinds of stuff that we do to throw up kind of flack, if you will. So there's a couple ways we do that. One is to become more assertive, and this is true whether you're a partner, whether you're an addict, to learn how to communicate more effectively. You know, we have reminder, therapists talk about 3 kinds of communication styles. The passive aggressive, which is kind of indirectly being aggressive. The most extreme case of that is slashing somebody's tires, right? Or cutting them off, or not responding, or there's all kinds of ways we can be passive aggressive. And of course, the opposite of that is aggressive, right? Being overly aggressive, overly angry, defensive, kind of in your face kind of attitude. Neither of those are good strategies. So what we talk about is assertive communication. How can I express my needs to you in a way that's respectful, but also honors what I need to say, right? And so that ability to become more assertive and express my needs, or say no, right? That's another thing a lot of people have a hard time with, is saying no, that's okay. Having those boundaries, holding those boundaries. And we allows us to communicate while still keeping the relationship having a positive tone and communicating in a healthy way. The other part of speaking, communicating, is listening. And that's the other big half of interpersonal effectiveness, learning how to listen, learning how to be an active listener, where we give body language that shows we're engaged, where we maybe repeat some phrases, where we lean in, where we learn how to not interrupt, where we learn how to say, would you like a response, as opposed to automatically jumping in and saying what we need to do or what the problem is. And, you know, to paint with a broad brush, you know, I think men generally tend to just go right for the solution, right? And women, I think, generally want to process more, which is a good thing. And I think so this helps some of our male addicts in recovery learn how to sort of talk about their feelings, identify and process them, as opposed to skipping over that whole middle part. So that's an example of interpersonal effectiveness. I wanted to give an example of one of the acronyms that fall into this category, and the acronym is GIVE. And DBT is full of things like that, little words, and each of the letters in GIVE stand for a tool or a skill, right? And so the G stands for be gentle, you know, don't attack. And this is just something we can keep in mind as we're communicating. Don't attack, don't threaten, don't judge. You know, handle this conversation in a gentle way. The I in give would be interest, show an interest, right? Have good listening skills, be engaged, be connected. which I think is what basically is the core of everything, but it's often what doesn't happen. Certainly, while addiction is active and often in recovery as well. The V would be validate, to acknowledge the person's thought and feelings. That this is very much, if you know the Imago dialogue, very similar to that, right? We mirror back, but then to acknowledge the thoughts and feelings, to validate, gee, that makes sense to me. I can see how you would feel that way. I can see that you would be angry or upset. That makes sense, right? And I can see that. So, and then the E would be to easy, right? This is where when tension starts to get complicated or when tensions rise, to kind of have an easy attitude, to try to smile, stay light, and keep engaged in the conversation. So that's the third, the interpersonal effectiveness. And the fourth and final one I want to talk about is just emotional regulation. And, in recovery, in early recovery, whether you're a partner or an addict, there's a lot of what therapists call lability, right? There's ups and downs, mood swings. In treatment, we talk about the roller coaster and how we often warn our clients that you and your partner are on different roller coasters. So when you're up, she or he may be down, and vice versa. So there's a lot of mood swings and emotional ups and downs. So this regulation skill is really important to identify negative and often very powerful feelings. For example, to identify and name and change emotions. Addicts notoriously are bad at naming feelings. When I got into recovery, I just kind of felt bad. I didn't really have a vocabulary to name and differentiate a lot of different feelings. And one of our daily check-ins with all the guys in our unit in Los Angeles is to ask them to name 2 feelings. So we get in the habit of doing it. And we provide several different resources, right? A list of feelings, emojis, feelings wheels, where they can see how different feelings kind of cluster together with these emotional tones. And so that ability to identify and express feelings is increasingly an important part of DBT. And then all these things basically, it's not only identifying feelings, it's expressing it and expressing it appropriately, right? And so these 4 sets of skills, and if you get a DBT workbook or any kind of book, there's courses, you'll see it gets much more complicated than this. But I think this is a beautiful set of skills. One of the guys in the group I was in last night had DBT for Dummies from the For Dummies series, and he was really singing its praises as a way of kind of making sense of these different skills. So I think oftentimes in recovery, we have good intentions, but I think oftentimes, at least speaking for myself, before I got into recovery myself, I kind of missed the handbook for life. I didn't have good life skills at all. And I think that's true for a lot of people. And DBT provides really practical, common sense skills that are highly effective. It's been around forever, not forever, but many years. And it's really powerful. So I'd really encourage everybody to check out DBT, Dialectical Behavior Therapy. I think I'll stop there. Thanks.
Thank you, David. So when I was first really learning about how addiction is treated, CBT, cognitive behavioral therapy, was sort of the gold standard. And over the last decade and a half, that has kind of morphed into DBT. And you explained DBT wonderfully. Thank you. What is the difference between, you said it's kind of a different angle than CBT. What are the real differences between DBT and CBT?
So CBT, cognitive behavioral therapy, really looks at how thoughts and our beliefs can affect a feeling. And there's a little equation there. And so if we want to change our feelings or our emotions, we need to go back and really examine our thoughts that led to that feeling in the first place. And so it's looking at that connection between thoughts and our beliefs and the resulting feeling. DBT, the idea of dialectical, looks at opposite. It means literally looking at opposite forces. So that looks at transitions between how we're at and where we're going, and sometimes those kind of illogical leaps that have to be necessary. So, as I say, DBT isn't quite as in the head, which, by the way, for many addicts, as simple as it sounds, cognitive behavioral therapy, which is the standard basic therapy, oftentimes the minds of addicts are a little bit fuzzy, right? And that happens with even post-acute withdrawal, up to 6 months. The addict can be have trouble kind of getting a clear head, getting logical thoughts. And so CBT actually is a little more complicated sometimes, but it's not, I don't think it has the practical applicability that DBT does in terms of just out of the box important skills to use. And I'd also say where CBT, cognitive behavioral therapy, requires some insight, DBT is more mechanical. And so one of the ways we use that at Seeking Integrity is with developing compassion and empathy, which again is notoriously lacking sometimes for an addict, especially sex and porn addicts. We hear that all the time in the questions we get, where we don't get feelings. And empathy, by definition, of course, is feeling what someone else is feeling. And if the addict isn't really feeling anything in themselves, they have nothing to compare it to. It's really hard to develop that. DBT, Dialectical Behavior Therapy, provides skills that help the addict and anyone really get in touch with how to do it. And they may not be feeling it yet, but they learn how to, for example, one of the exercises in that interpersonal effectiveness that relates to compassion and empathy is I want, you want, just that basic, right? What am I feeling? What are you feeling? What do I want? What do you want? How do we negotiate that? So it's more practical, I guess, is the bottom line. Long way of answering that.
Yeah. I mean, it kind of seems to me like the premise of CBT is if you want to change your behavior, change your thinking. Whereas the premise of DBT is if you want to change your thinking, change your behavior, which is an easier thing for most addicts to do because our thinking is so ingrained and so out of whack with all the denial and manipulation and denial. We lie to ourselves first, so it's very hard to change our thinking.
No, exactly, and because of that, addicts don't have much insight into their thinking or their behavior patterns, and there's still remnants of denial, and our thinking is skewed. And so to build a foundation on that is hard. So these skills really allow us to start making progress that actually impact our thinking and how we see ourselves.
Yeah, and there's also some very specific tools of recovery for addicts in general and also for sex addicts that are very sort of DBT, like, here, do this. When you recognize you're having a triggering thought, this is for sex addicts especially, somebody walked by in front of you and you start to objectify them, use the 3-second rule. You have 3 seconds to think about something else, to turn away, to humanize that person, to ask, turn it over to your higher power, whatever actions you need to take in that 3 seconds. And it works, just simple things like doing a gratitude list or mindfulness exercises, like you mentioned with number one, just some breath work or 5, 4, 3, 2, 1 grounding, which we've talked about numerous times.
Right.
And these are DBT skills, but they're sobriety skills. And really DBT has become the gold standard for this reason.
And I think that's why I think it's such a good fit for a lot of people that are familiar with the 12-step program, whether you're on the addict side or the recovery, the partner side, because we've heard all these things in a way, right? They're part of slogans and techniques and tricks and tools and ways to distract ourselves. And DBT kind of is a way of formalizing all those in a way that's very powerful.
Yeah, and I mean, it's a behavioral problem. Addiction is a behavioral problem. It requires a behavioral therapy. Exactly. Yes, we need to change our thinking. Yes, we need to change, but the way to get there is through action.
Right.
Not through, addicts we're very good about thinking our way back into active addiction. And these are not the only methods, by the way. We'll bring in, we don't do EMDR work, even though David is qualified at the treatment center because it's too early in the process, but we do sometimes we have art therapy or psychodrama at various points.
Breath work. We've done breath work before too.
Yeah, we've done breath work and meditation and things like that. We do alternative things, but mostly they're active things that we bring in. Even like an art therapy or a psychodrama or a breath work, it's an active, almost a skill a little bit. which is
Yeah, and
more
in
about
fact,
behavior opening the mind than vice versa.
exactly. I think a lot of out of necessity, focus in early recovery is kind of practical skills, right?
Right.
And then the insight follows, but
Yeah.
it doesn't show up in the first day.
Yeah, and we've talked about this before. We don't tend to do. We'll uncover trauma and identify it to be addressed later, but we don't really want people doing deep trauma work in early recovery because they're very likely to relapse. Trauma work is very triggering. So they need some sobriety skills, some DBT skills that they can use to stay sober while they go through the emotional pain of trauma work.
Exactly right. Exactly right. Yeah.
All right, let's jump into the Q&A. This first one is very long, so I'm going to shorten it for you. This is a sex and porn addict husband who also had an emotional affair. And the wife writes, "It's very painful, leaves me feeling unsure of my feelings for my husband. I have accepted that most of this pain is not anything I did, but the fact that he vilified me in order to not feel guilt and shame about his behavior. I feel he has to fix what he messed up now more than ever. He has read Out of the Doghouse and is using the workbook Help Her Heal, which is a workbook for men who cheated by Carol Jurgensen Sheets. It's excellent. But as his wife, I need more than that. Any suggestions?"
Boy, at some point, I think each couple starts to have their own journey on this. There are common themes for sure, but I think the issues may vary. Although you name some common things, the blaming and how addicts will kind of project onto their partner in order to avoid really taking a hard look at themselves and their behavior and changing their behavior. So I think the best thing I can suggest is communication and really good communication. At some point, we've talked before about, this is my opinion about the role of a couples counselor or therapist in this. And I think in the beginning in recovery, I think it's both parties, the betrayed spouse and the addict, are best served by having their own therapist, doing their own work, building their own skills and resources. And then a little bit down the road, perhaps around the time or after the disclosure, that's when they start to need to really formally work on the relationship itself, which is kind of where this writer is speaking of. I think that where you started to heal some of the damage that was done in the course of the addiction, kind of the remnants of the scars, if you will. And I think really one of the best ways to do that is a disclosure, first of all, and then just really talking about it, frank, honest communication, and then practicing the skills. Even the ones we talked about tonight are applicable, because we do see, and we often hear in these questions, there are remnants. The blaming may continue or pop up. There's old addictive patterns that may pop up in the course of the work over the course of recovery. And I think those have to be handled on the spot, right? And as they come up, and daily check-ins, communication patterns that are routine, and also I think communication and skills in the context of couples therapy. That's where the healing can start to happen. But I think I'm glad, first of all, to this person, they've accepted the fact that it's not something they did. I think that's one thing that a lot of partners feel in the beginning, that this is somehow my doing, and I'm somehow responsible for protecting the ongoing recovery. And that's not the case at all, right? It's up to the addict, it's their responsibility. But it's also important for the addict to process the harm they've done. I think so well along in the steps, we see the amends phase and other kinds of processes going on. I think that also helps heal. But I guess to sort of summarize this, what feels like a long rambling answer, I think it's a process that takes time. And there's no quick fixes in this. And nobody does it perfectly. And so the best way I can think to manage things as they come up is to have really healthy communication.
Yeah, and part of that, this is why some like number 2 and number 4 from earlier, distress tolerance and emotional regulation, are so important, because when the overwhelm comes up, distress tolerance is really important. I want to ask one more question about this. You mentioned acceptance as part of distress tolerance. Now, acceptance is also the last stage of the grief process. Is part of DBT maybe walking people through grief and helping them get to acceptance, or am I talking about two different kinds of acceptance? I mean,
I think the acceptance as it's used in DBT is to accept the situation and myself where I'm at today.
okay.
So it's like, okay, this is messed up, here's what I did. I need to look at myself. And it's not so much a process as an endpoint of grieving, but I think more just kind of being realistic about, okay, where I am at today and what do I need to do about it?
Okay, thank you. Next question, is it possible for some people to be too early in their recovery to benefit from support groups? My husband has attended some of the groups, but says he feels worse or more depressed after the meetings. He already struggles with depression, lack of motivation, and avoidance. He's very early in recovery, just started therapy with a CSAT 2 weeks ago. David.
Well, my feeling is that a support group is always appropriate. And I think oftentimes people find a support group before they find recovery, right? At least I did. I muddled around in and out of support groups before in AA before it stuck. So I think, and again, everybody's individual, but I think we bring stuff to the group. And I think, if there's a depression in there or other kinds of complicating factors, that could be something going on. I will say when I have clients who have this reaction to a meeting, I kind of talk about the concept of beginner's mind with them sometimes. Beginner's mind being, let's go into this with no preconceptions, with no predetermined opinions. And another thing that happens often in sex addiction meetings is that because sex addiction can be represented by so many different kinds of behaviors, it's really easy for somebody to go in and say, whoa, look at this, the people around this room, I never did that, I never did that, wow, I'm not as bad as, and so we start to compare. So I always encourage people to find the whatever factors they have in common as opposed to comparing. And I think if you're comparing yourself, it's like, oh my God, you can walk out of a room feeling depressed, and you can always find a way to minimize what you do compared to what you might have heard on a meeting. But I think, people are complicated. Your husband, I think, sounds complicated. I think the depression issue, the lack of a motivation, is part of maybe denial. I think a lot of this can be explained as part of kind of normal addiction. I'm really glad he's with the CSAT. I do believe a CSAT can really help with that and kind of process the feelings, like, okay, what's going on when you go in the meeting? What are you thinking, and what are you concluding? What are you seeing? And are you making those mistakes I mentioned, like comparing instead of trying to identify, and so on. The other thing is a therapist can do is really assess mood. There's a high co-occurrence of depression and anxiety disorders among addicts, but sex addicts in particular. And very often there's a depression, or a low-grade depression even, that might be existing as well. So there might be other stuff here besides the addiction that's impacting how he reacts to this. I do want to say, I think we've discussed this maybe last week or recently anyway, though it's really important to not necessarily make a major diagnosis of some other kind of disorder like depression or anxiety too early in recovery, because as we've said many times here, addiction in all its glory and how it looks even in early recovery can resemble some pretty scary diagnoses. I've had a lot of chemsex users, for example, who were diagnosed as bipolar or even schizophrenic, and it was just their addiction. A month or 2 months later, they were perfectly normal. But so I think I'm suggesting that the CSAT should probably screen for depression. I'd be cautious if it were me about diagnosing it, but I'd certainly be aware of it. And so I think, I'm really glad he's in the right place. This is somebody who has experience, the therapist, and he can evaluate and help, and hopefully help him feel more comfortable in meetings.
And addicts often have a negativity bias, particularly with anything new that's a little scary. This isn't going to work for me. I'm not going to identify. We walk in the door expecting to fail. and so we fail. So this goes back to what David said about the beginner's mind. Just drop that and go and see what you can get. All the things David said are just so common. And addicts are notorious for not wanting to go to support groups. You know, and if we could recover on our own, we would, but we can't, which is how we end up here and how we end up with a CSAT and who's saying you have to go to 12-step meetings, all right? We need other recovering addicts. Without the support of other recovering addicts, it doesn't matter how wonderfully supportive our wife or partner is, or how great our therapist is. We need more than that. We need other recovering addicts. Why is the input from other recovering addicts so important, David? I mean, what is it about that puts us over the top and into sobriety?
I think there's a couple reasons for that. One, well, we just know that connection is vital. And the reason it's vital, in my opinion, is that it allows us to see ourselves in other people, for one thing. I can't see myself really honestly or get a good, but I can see it in a person that I may be going to a meeting with. And they can see it in me, and they can give me feedback in a way that my partner can't or my friends can't, because they've been there, they know it. They can call me on my BS or support me when I really need it. So I think that connection is really important, for sure. But I think also just the ability, I think a lot of addicts suffer from this kind of a little bit of a uniqueness and just not belonging anywhere. I think there's a huge healing factor in the idea of belonging and having a place. And I think that's important too. You know, if I could have read a book and gotten sober, I definitely would have. But when I did finally go to meetings, it was like a gut reaction. It's like, oh my God, you know, these are my people. They understand me. I really thought I was quite unique in the world, you know, and here's a whole room full of people, and in a city full of rooms full of people, you know, all the same way. I often talk about when I go to LA from my home here, I'll often experiment with going to new 12-step meetings, and I may be in a meeting I've never been in before, and I walk in and I feel, oh, I'm home, you know, and even I can go to a place overseas that doesn't speak English, and I feel the same way. So I think there's a sense of belonging and purpose and connection that really is healing for me. At least it was for me, and I think I see it in my clients as well.
Yeah, thank you. My therapist has given me work to do with honesty. Part of that is giving myself grace when I make a mistake. This feels very different to me, and I find myself feeling bad for not feeling bad enough for something I've done wrong. How can I tell that I'm giving myself grace in a healthy way, as opposed to giving myself a free pass to the emotional consequences of a poor choice? This is a great question.
Yeah, we get great questions in this group, I gotta say. This is another one. Yeah, so first of all, what's going on here when we, every human being probably, but especially addicts, have that critical inner voice, right? That's full of, it grows out of our negative core beliefs about ourselves, that we're somehow unworthy or unlovable or unique or whatever the belief may be, and all the shame that is such a classic feature of sex addiction particularly, but addiction in general, the shame, all the stuff kind of filters up and is a constant like critical voice in our ear that just chatters all day long. And I think that's our first response. And as with anything that we do over and over and over again, those become automatic. So the negative voice becomes an automatic response. And it really takes a while to change that. It's a habit, to change the habit. I was talking to our clients today when I think I like to use the analogy of like looking at a video or a film and just taking it down slow by frame by frame by frame, and then freeze frame at that moment where, okay, now I could do a negative voice automatically, or I could go to plan B, right? And do the affirmation, or do what your therapist said, to be a little more gentle with yourself, or take another approach. And it takes a lot of practice, because we zoom right past that fork in the road into the automatic negative thought without even knowing it. So I love the approach. I love that you're struggling with it because it doesn't feel natural at all when we first start doing this. It's an awkward kind of thing and really counterintuitive. One of the, in fact, interesting to bring it back to DBT, one of the things is do the opposite, right? Do the opposite. When we have an instinct to do something, at least do the other thing, because our emotional wiring may be kind of misguiding us or misdirecting us. So in this case, I love the advice. I love that you're struggling with it, that means that you're really thinking about it and practicing it, and you're going to get it. Because I think that giving yourself grace, first of all, we don't do that very often, but to do it in a healthy way, I think is great. Now, it's a little more complicated to tell whether you're giving yourself a free pass. In my experience, until I got some practice with it, I didn't know that. And I relied on other people. I would take situations and process it with your sponsor, with your peers, with your therapist, and say, hey, this is what happened. This is what I said to myself. Do you think I was being too easy on myself, or was I giving myself a pass, or was I doing this right? That feedback, that we were just talking about how important peers are and connection. That's one of the critical aspects. We have resources now. We can ask and get, because honestly, for these kind of skills that are so counterintuitive for the way we're wired, there's no gut feeling, okay, this is right or not, until we learn that new skill. So you're gonna have to rely on other people kind of helping guide you to sort of get your own ability to feel it yourself, I guess. Yeah. Any ideas on that, Scott? I'm curious what you think.
I mean, I totally agree with you. A lot of times the skills we have to learn in recovery are skills that other people seem to have innately, but it's because they've spent a lifetime learning them and we haven't. So we're essentially learning a new language, or we're learning to play a musical instrument that we've never touched before. And I mean, I played the French horn as a kid, and I know like the first year, my poor parents must have been like, oh my God, what is that thing? Did we actually agree to this? Yeah. Because I was bad at it. And, it wasn't like I wasn't practicing. It took me like a year before I could actually make reasonable noises with it. So, and this is the same way, and probably harder. I think anything that's emotional is hard, particularly when we're combating our own shame and our own negative self-image. It feels weird to give ourselves grace. It really does. I mean, even today for me, it feels a little weird to be nice to myself sometimes.
Yeah. I want to just bring up something you mentioned before, Scott, and that's negativity bias, right? Negativity bias is where we kind of train our brains and ourselves over time to just kind of, it's like the glass half full. Right? We see all the bad stuff around us. We tend to ignore the good stuff, or we don't have a balance. And I think this is kind of illustrates that. We're used to thinking in negative ways about ourselves, a lot of it driven by shame, as Scott said. And it's a new skill. And that requires balancing out the negativity with other stuff. And as you can balance the good and the bad, then you have, I think, a much better perspective on whether you're giving yourself a pass or not, because you have a better intuitive sense of it.
Yeah. Okay, next one. I feel bad for others when they are upset. I even get emotional in sad movies, but when my wife gets upset, I feel very little at times. This is very different to when we first met. I do still love her, but I shut down when she is upset. I even get frustrated by it. Have I dehumanized her over the years to allow myself to treat her like this and act out in multiple ways? And now that I'm trying to reconnect, I can't find the ways to emotionally connect with her. So there's a lack of empathy for the wife now, although it's coming back, it sounds like, with other people. Is this normal? What's going on? What can we do about it?
Yeah, I think the scenario you kind of describe here is not too unusual, in that sometimes people can access feelings in a movie or a book or with someone else or over a pet or something like that. But for the person, the human being who's closest in their lives, they have a real hard time connecting with the emotion in that sense. And I think all the things you said are probably true. You know, that in the course of addiction, we do tend to kind of cut off feelings, not even on purpose, but it just kind of evolves with the addiction with people that are close to us because they can hurt us, because that's where the vulnerability is. I think they're often, ironically, the last person to start to share that emotional bridge with, because they can hurt us, they can make us cry, they can destroy us, you know, emotionally, in our fantasy at least, with words. And so I think kind of quite the opposite of what you say. I think because your wife is so important to you, that it's harder to actually be vulnerable around her now. And again, and that sounds weird, but going back to what we just said, I think over the course of the addiction, we kind of lose track with that. We get buried into our own kind of closed system. And it's a good thing, I think, that you're starting to feel feelings. I think that's probably not different than the normal. I've never seen any research on this, but in my own anecdotal experience, the way feelings kind of come back online is in movies or in books or in situations or things that are safer to allow ourselves to feel that, because it's not quite so emotionally close. But things like our marriage, that's a little bit more, that's close to home. And I think we're still more guarded, even if we don't want to be. And it sounds like you don't want to be, which is good. But so I just keep trying, keep going for it, keep allowing yourself. And I think with time and practice, and as you get more confident in yourself and in your partner, and in terms of the reaction, and you're mostly, honestly, to bring it back again to DBT, that the idea of that self-regulation, as you gain confidence in your ability to not get, not lose control of your emotions, it'll be easier to start feeling them. So I would just give it time. You have the right intention, and I would just keep practicing.
Yeah, you know, I can tell you my personal experience. When I got sober, there were a couple of commercials on TV, and I probably shared this before in here. One of them was a McDonald's commercial, and it's raining out, and the little girl's in her rain slicker, and she's stomping along, and there's a little line of ducks following her. And I don't know what that has to do with McDonald's, but it was so cute. It made me cry. And then there was another one. It was a little kid who gets like attacked by puppies, basically. And he's rolling around on the ground and laughing his ass off. And the puppies are like crawling all over him. And it was so cute that I would cry. I would cry at those commercials, at Hallmark commercials, every Hallmark commercial. I would cry. And sitcoms, I would cry if there was a poignant moment. But they weren't threatening to me. I could feel emotions safely because there was no threat. If a family member was having emotions, I got annoyed, I shut down. I was still a cranky jerk because it was scary to me. They could hurt me, they could leave me. You know, I had to work my way up the ladder. You know, I started with TV, I started with books, worked my way up to fellow recovering addicts who are fairly safe to be, you know, vulnerable around, because they're a mess too. And you know, if some recovering addict that I've known for a couple months treats me badly, it's probably not going to break my heart. There's plenty of other people that I can, you know, find support from. But yeah, a partner, a parent, a sibling, you know, they are the last people invited to the intimacy party, because they're the people who can hurt us the most. David said that these are the people who can really hurt us, and it's scary. So of course we shut down. I mean, this is what addicts do. And again, you're learning a new skill, you know, and how to be empathetic, how to feel, you know, and it's hard. David, what are some of the techniques that addicts use when they're trying to find empathy for someone who is scary to them? I mean, how do they go about it? Or when they're just struggling to find empathy, period? What are the questions they ask? How does that what is the dialogue?
I think it's kind of a two-pronged approach, right? One is internal, like, and that goes to self-regulation, kind of calming, getting clear, staying regulated, not reacting. Again, that difference between reacting and responding. But I think just checking ourselves, being okay, being able to bring ourselves back to neutral and stay connected with our feelings, because that's one thing addicts also do automatically is we disconnect from feelings. It's like a breakaway parachute. You know, if things are starting to get tension, it'll break away. And so I think learning how to stay connected to the feeling, even though we're scared, it's scary. So that's the inside job. But the outside is really trying to also stay connected to that person and to really hear them and to not make assumptions of what they're saying and to take it at face value and even practice. My example of that, I'll just say as an example here, I got sober a long time ago, back when communication was a whole different thing with phones, and the commercial that broke me up every time was an AT&T commercial back, and it showed a kid in the United States with his parents dialing his grandparents in Portugal, and hearing their voice, right? This shows you how long I got sober, but it just broke me up. But the reason it did is because I desperately wanted to connect with my own family, and that was but I was afraid to, right? And every time I was around them, I'd get annoyed and irritated. It's like, what's going on? But it was just that. And so I had to really learn how to, okay, I'm okay by myself, but also then to really approach these family members with whom I had a lot of bad history in the present. A lot of the stuff we talked about earlier with DBT, staying in the present, staying connected, staying non-judgmental, and that gradually with practice, it kind of worked its way out. But feelings are scary. Addicts, like the main MO of an addict is to avoid feelings most of all. And so to engage in a way that was vulnerable with people that had hurt me at one time was really a big deal. So I think it's to answer your question, Scott, I think it's monitoring ourselves, stabilizing ourselves, but also being non-judgmental, being open, being assertive, all those things, expressing our needs, knowing if it didn't go well. Sometimes in those early days, my first attempts at reestablishing that connection kind of went south. Okay, let's cut this one off for now and try it again some other day, And so knowing how to protect ourselves as well. There's a lot of skills involved. It sounds easy to reach out and talk to somebody, but there's a lot of skills involved.
Yeah, and as you work on developing empathy, you really do have to practice it. And you say, I think what I heard you say is this. Please tell me if I'm hearing you correctly. And if when you finally hear them correctly, then you say, I think you might be feeling this and this. That's probably what I would be feeling. Am I correct? I mean, and you're not going to get it right. Or if you do, it's pure luck in the beginning. But that's
Right.
Okay.
Exactly.
That does two things. Number one, it helps you learn. And number two, it tells your spouse you're trying.
Exactly.
Even if I'm not feeling it, I'm trying to feel it. And that's valuable. That's worth something, because you will eventually learn this skill. And empathy is a skill. David has said it 100 times. You can learn empathy. Some people are innately more empathetic than others, but you can learn to be empathetic.
Right. I think I mentioned, we did a thing on empathy within the last couple of weeks, so I mentioned this then, but I'll say it again. I tell my clients, if you're learning empathy, and addicts in recovery are beginners at empathy, right? I say it's okay to guess or to ask. If I'm talking to my partner and said, gee, I can understand that you would be upset by that. I'm sure you must have been angry or you must have been hurt. And they might say, no, I was this. And so I'd encourage partners to be open to the addict trying, and they may get it wrong, but then that's a great opportunity to talk about it. And this is what I'm actually feeling. But as Scott just said, it's so important to kind of reveal the process, because it shows you're trying. You're not just being flip about the relationship. So yeah.
Yeah, and that's people skills, number 3 on the DBT list,
Right.
right there. Do all addicts have poor self-care? Yes. Is it lack of self-worth or a consequence of escalating addiction? Yes and yes. David, thoughts?
Yeah, I mean, all of the
Right.
above. Addicts definitely have poor self-care, despite coming off as so narcissistic and self-centered and all that. The amount of self-care they actually do is pretty terrible. And I look at self-care in terms of, physical self-care is what we think of, obviously, right? The adequate nourishment and drink and sleep and all that. But there's also emotional self-care and taking care of our feelings. And maybe we have anxiety or depression or trauma. And just really monitoring that and taking care of that, getting help if we need it, right? For those I mentioned earlier, that there's such a high degree of correlation between those various disorders. Emotional self-care, spiritual self-care, right? I think part of that's an opportunity for real growth sometimes in addicts, and because an addict may think of themselves as the center of the world, or their world at least, and learning that something bigger, whatever that is important. So yeah, so self-care is notoriously bad among addicts, and I think as is self-worth. And again, it seems counterintuitive given the narcissistic behavior, but I'd have never met an addict who had really good self-worth at all when we got down to it on the inside, right? A lot of the bravado and the acting out and the disregard for other people sometimes is really reflective, I think, of a lack of self-care inside. And so it's a consequence of the addiction as well. As the addiction escalates, we see this with intensity addictions all the time, with sex and porn and chemsex. That lack of empathy, if there ever was there, really dries up, and people just have an intellectual understanding sometimes that, yeah, what I'm doing could hurt my partner if they ever were to find out, but they don't think about that too much, and they don't feel what their partner might be feeling. So all that self-care is related to the stuff we're talking about, and yeah, so self-care skills are huge, and that's another reason, by the way, to connect with other recovering people, because they can help us and they can call us out if they see that we're not taking care of ourselves. If I decide I really only need one meeting a week, that's poor self-care also. If I really need more than that, which most addicts do. So yeah, we can fall into our own little universe, and we need that gentle prodding sometimes, or sometimes not so gentle prodding, to get us back on track.
Yeah. And this is straight up DBT stuff. It's learning skills. And, somebody told me early on, if you want to build up your self-esteem, behave in esteemable ways. And that's sort of a DBT skill. It's like, oh, change your behavior and the brain will follow. And once the brain is there, then the heart will follow. It takes a while, but we get there.
That's right.
Okay.
Absolutely right.
Yeah. Next one, how can you tell when it is okay to expand on vanilla sex? My wife has said she'd like to vary our sex life like we used to, but she doesn't know if this would be unsafe for her and to my recovery. This is another great question. And I'm just going to let you answer. I have thoughts, but I'm going to let you answer because you have better thoughts probably.
It's a great question. I'm most of my career, I've dealt with chemsex, which can be pretty extreme. It's amphetamines and methamphetamine and cocaine and sex, and the sex gets pretty out there, wild. And so the answer always, in early recovery, basically, I've had clients say, you're in recovery, I'm being doomed, to a life of vanilla, boring, or no sex at all. And that's, of course, not true, right? And what we do in recovery, and it's a long, slow process, but we're starting to broaden the neurochemicals we use in our intimacy and our sexual life, right? So it's not just dopamine, and adrenaline, but it's serotonin and norepinephrine and these other chemicals that have different sensations, right? There's the feeling oxytocin, it's connection, it's bonding, it's physical calmness, it's physical connection. So there's a whole much more subtle set of tones, if you will, in the sexual behavior. So I think that's what we're going for, and it's connected, it's intimate, it's not just performative. It has a broad range of stuff with touch and other things. I'm sex positive, meaning I think sexuality is a healthy thing. It's a wonderful thing. It's a way for two people to express their their desires consensually, right? Now that gets a little tricky for a sex addict in recovery, as you rightly point out, because this can be triggering. Sometimes the behaviors that we want to pursue with our partner kind of echo stuff we might have done in terms of our acting out. Sometimes, and these behaviors and sexual activities are really deeply grooved, meaning if I start to engage or even think about some of those behaviors, I start to get a trigger to drop into addiction. So it's a tricky business, but I think it's not something to lose sight of. I think it takes some time. I think it takes some sexual intimacy, the development of intimacy and connection. And I think with a healthy connection, that provides a foundation to start to explore some of these things. I'm a sex therapist in addition to a CSAT, and I think it's really important to kind of lay out, again, communication, ground rules. What are we looking for? How are we going to do this? How are we going to know if it's, whoa, I'm getting a little triggered here? You know, how can we back off? But it's all about communication, both verbal and nonverbal, actually. And it's all different. There's no magic number to say, okay, at a year, you know, you can go out and go wild. Every couple has their own trajectory with this. And I think it's all about communication. I would work closely with your CSAT or a sex therapist who's informed about addiction before you start to introduce stuff. But there's no reason, in my opinion, no reason why you can't mutually get into some things that you both find pleasurable. But I would be very careful about the timing, that's all. Because early on, it can, remember, these patterns are deeply grooved and it can overwhelm our ability to kind of not get triggered by them. Now, that said, I think there are certain things that I think are just kind of no-go, certain kind of fetish behaviors that, at least in my experience with chemsex, they're so tied up, the drug state is so tied up to that act. I've not known many people, if anybody, who can do that act in sobriety without getting triggered. So those are all personal. So just approach it with professional skill, but be open-minded and be cautious about the timing.
Yeah, I agree 100% with everything David just said. And I will add that I'm a big fan of a safe word or a stop and talk word. You know, the safe word can be, we need to stop, or it can be, we need to stop and talk and assess, and, you know, because I'm starting to feel triggered, or you're starting, you know, I think maybe you are, let's stop. I mean, the nice thing about sex is you can pause, you can stop, you know, it's like, no, this sounded like a good idea, but let's pause, maybe take it up again in it next time, or 10 times from now.
Sex should be playful, not scary,
yeah.
Right? But
yeah,
to make it playful takes some work.
Talking is part of what makes it playful too. Does that feel good? No. Well, what about, oh yeah, that keep doing, you know, if you're not laughing during sex, you're not having good sex. That's my personal opinion.
Two things I just got to say. Sensate focus. We've talked about that a lot. Masters and Johnson exercise, which helps couples start to establish that foundation. And shameless self-plug, I'm doing an intimacy skills for men in recovery group starting in late October, followed by a healthy sex part 2. So a lot of the stuff we're talking about is in that coursework.
You have to take the intimacy skills work group before you take the healthy sex work group. It's a prerequisite. So sign up for it. It starts October the 24th. And we have questions left, but we don't have time. So I'm going to copy them and save them for next week. You're going to be here next week, David. But
I'll be here next week. Yes.
Okay. All right. So we'll be back, both of us, next week. Please join us. If we didn't get to your question, I apologize. We will do them first next week. Thank you, everybody, for being here for great questions. David, anything to take us out?
Just check out DBT if you're not familiar with it. It's a great tool.
Yeah.
All right. Thank you, Scott. Good night.
See you next week.